Hello all, let's see the maxillary artery. Maxillary artery, it is the larger terminal branch of the external carotid artery which is given off just behind the neck of the mandible, and the other smaller branch, that is the superficial temporal branch, which passes upward to supply the temporal region. This maxillary artery, after getting origin from the external carotid artery behind the neck of the mandible, it runs medial to the neck of the mandible and reach up to the lower border of the lateral pterygoid muscle, and from here this artery curves superficial to the lower head of the lateral pterygoid muscle and reach up to the gap between the two heads of the lateral pterygoid muscle, and from here this artery, after passing between the two heads of the lateral pterygoid muscle, it enters into the pterygopalatine fossa through this pterygomaxillary fissure, and this way this lower head of the lateral pterygoid muscle will divide the maxillary artery into three parts. The first part, it is the part of the maxillary artery which is running below the lower head of the lateral pterygoid muscle, and that part, it is the mandibular part. The second part of the artery, it runs superficial to the lower head of the lateral pterygoid muscle, and this part, it is called as the pterygoid part of the maxillary artery. And the third part, which passes between the two heads of the lateral pterygoid muscle and enter into the pterygopalatine fossa, and this third part, it is called as the pterygopalatine part. This maxillary artery, it is also called as internal maxillary artery, and this three part of the maxillary artery, they provide so many branches, and out of all the branches the second part gives mostly muscular branch, and that's why they do not need any foramen to enter into the skull, while the first part and the third part of the maxillary artery, they need some foramen to enter inside the skull and provide the blood supply to the related area. The branches from this first and second part of the maxillary artery, they accompany the branches of the mandibular nerve, while the branches from the third part of the maxillary artery, they accompany with the branches of the maxillary nerve as well as the pterygopalatine ganglion. Now, before going into details of the branches of this maxillary artery, let's orient with the skull through which the different branches of the maxillary artery they are going to distribute. And within this skull orientation, we will try to remember all the branches of the maxillary artery. Now let's see the orientation of the branches of the maxillary artery within this dry skull. Here we know this is the mandibular fossa, and the neck of the mandible somewhere lies here, and this maxillary artery, it is going to reach up to the back of the neck of the mandible, and behind the neck of the mandible it will passes below the lower border of the lateral pterygoid muscle, which is going to insert over the pterygoid fovea. This first part of the maxillary artery, that is called as a mandibular part, and it gives the 5 branches, and the first branch of this first part of the maxillary artery, it is the deep auricular artery. This deep auricular artery, it passes upward and it pierces either the bony part of the external acoustic meatus or the cartilaginous part of the external acoustic meatus and enter into this meatus, and going to supply the outer surface of the tympanic membrane as well as the external acoustic meatus. The second part, it is the anterior tympanic artery. This anterior tympanic artery, after going to arise from the first part of the maxillary artery, it enters into the petrotympanic fissure, and through this petrotympanic fissure it is going to, here this is the petrotympanic fissure, and through this petrotympanic fissure it is going to enter into the middle ear cavity to supply the inner aspect of the tympanic membrane, which is going to anastomose with the posterior tympanic branch, which is actually a branch of the stylomastoid artery within the tympanic cavity. The third and most important branch, that is the middle meningeal artery. This middle meningeal artery, it is going to arise from the first part of the maxillary artery. It passes upward where it is going to embraced by the two loops of the auricular temporal nerve, and this artery it is going to enter within the middle cranial fossa through this foramen spinosum. Through this foramen spinosum, it enters into the middle cranial fossa somewhere here, and after entering into the middle cranial fossa through this foramen spinosum, it is going to run over the squamous part of the temporal bone, and within the squamous part of the temporal bone it will divide into frontal trunk as well as one parietal trunk. This frontal trunk, it passes upward and going to run along with the inner aspect of the skull and the outer part of the dura mater, and it is going to supply the concerned area up to the vertex. This parietal branch, it will passes backward and it is going to reach up to the lambda after passing between the inner side of the skull as well as the dura mater. So all these are the territories supplied by this frontal and the parietal branches. Now before dividing into this frontal and the parietal branches, this middle meningeal artery within this middle cranial fossa gives few branches which are related to this area. The first branch provided by this middle meningeal artery within this middle cranial fossa, it is the ganglionic branch, and this ganglionic branch, it supplies the trigeminal ganglion which is present here within the Meckel's cave. The second branch, that is the Petrosal branch, and this Petrosal branch, it is going to pass through this groove for the greater petrosal nerve into the middle ear cavity. The third branch, that is the superior tympanic artery. The superior tympanic artery, it is going to enter within the middle ear cavity which is present within this petrous part of the temporal bone through the canal for the tensor tympani which is present in the anterior wall of the middle ear cavity. The another branch from the middle meningeal artery within this middle cranial fossa, that is the temporal branch. This branch, it is going to pierce this greater wing of the sphenoid and reach up to the temporal fossa where it is going to anastomose with the deep temporal arteries. And the last branch from this middle meningeal artery within this middle cranial fossa, that is the anastomotic branch, and this anastomotic branch, it is going to anastomose by the recurrent meningeal branch of the lacrimal artery which is a branch of the ophthalmic artery, and after passing through this lateral part of the superior orbital fissure. So this middle meningeal artery provides so many important branches within this cranial cavity also. This middle meningeal artery, it is the artery which is going to be injured most commonly by the fracture of the lateral aspect of the skull, and this hemorrhage, it is called as the extradural hemorrhage of the skull. Now the fourth branch of the first part of the maxillary artery, after having the deep auricular artery, anterior tympanic artery and middle meningeal artery, the fourth branch of the first part of the maxillary artery, that is the accessory meningeal artery, and this accessory meningeal artery, it is going to pass through this foramen ovale to enter into the cranial cavity to supply the dura mater. Now the fifth branch of the first part of this maxillary artery, that is the inferior alveolar artery, and this inferior alveolar artery, it passes downward and it passes between the ramus of the mandible and the spinomandibular ligament, and after passing between these two structures, it will enter into this mandibular foramen of the mandible. Before entering into this mandibular foramen, it gives off two branches. One is the lingual branch, and this lingual branch, it is going to supply the mucosa of the cheek, while the second branch, that is the artery to the mylohyoid, and this mylohyoid artery which runs outside the mandibular foramen, and after piercing the spinomandibular ligament, it will going to supply the deep surface of the mylohyoid muscle. After entering into this mandibular foramen, this inferior alveolar artery along with the inferior alveolar nerve, it passes downward and going to supply molar as well as the premolar tooth along with its adjacent gums, and it runs within the mandibular canal and it runs downward and forward. Before coming out from the mental foramen as the mental artery, this inferior alveolar artery divides into two branches. One is the incisive artery, and this incisive branch which is going to supply the incisors, while the mental artery which is going to coming out from the mental foramen to supply the outer mucosa of the lower jaw. So these are the branches from the first part of the maxillary artery. Now let's see the branches from the second part of this maxillary artery. The second part which lies superficial to the lateral pterygoid muscle, and this part it is also called as the pterygoid part, which provides all the muscular branches. And first muscular branches from the second part of the maxillary artery, these are the deep temporal arteries, which are usually 2 in number, and they passes deep to this temporalis muscle, and it lies between the temporalis muscle and the temporal fossa and going to supply the temporalis muscle. Other branches from the second part of the maxillary artery, these are the pterygoid branches, and these pterygoid branches they are going to supply the lateral pterygoid as well as the medial pterygoid muscle. The another branch from this second part, it is the Masseteric Artery, and this Masseteric Artery it is going to supply the masseter muscle from its deep surface after wrapping through the masseteric notch, as like that of the masseteric nerve. The another branch from the second part, it is the Buccal Artery, and this Buccal Artery it runs downward along with the buccal nerve and going to supply the buccinator muscle. So these are the branches from the second part of the maxillary artery.